and welcome to News9 Facebook Live. I'm Pratibha. The Union Health Ministry has issued management protocols for patients who have recovered from COVID-19. Now, the number of COVID-19 cases have been on the rise across the country, but our silver lining has always been the high recoveries that are taking place. Now, the Union Health Ministry has issued guidelines for the patients who have recovered from COVID-19. There are several suggestions that have been made, and at the same time the Union Health Ministry has also spoken of a few issues that the COVID patients have been suffering even after they recover from it. So today we're going to talk about that. An expert will also be joining me to get us more details on what one should do once recovered from COVID-19. In a few cases, we've also seen some complications. Recently, the Union Home Minister Amit Shah as well had recovered from COVID-19, but he has been admitted to the hospital yet again due to some health complications. And this is something that the experts are seeing increasingly in several patients, that even after recovering from COVID-19, they continue to face breathing problems, perhaps an increase in temperature as well. And this has given rise to some concerns as well. So today we're going to talk about that. Among the suggestions that have been made by the Union Health Ministry, the ministry has also spoken of yoga as well as Chavanprash, pranayam, as well as ways of boosting immunity in line with what the Ayush Ministry has said. These are some of the alternative medicines that have been suggested by the Union Health Ministry. Now, that might be something that not all doctors prescribe to the view that alternate medicine should be taken immediately after a patient recovers from COVID-19. But whether or not that being the case, there are a few other symptoms as well that the patients have been showing even after they recover. And this includes fatigue, body ache, cough, sore throat, difficulty in breathing as well. Now, this has been a cause of worry amid no clear data on whether there could be a resurgence of COVID-19 in a patient. Such symptoms remaining can definitely mean some inconvenience to the patient. So in the guidelines, the Union Health Ministry has also said that even if recovered, the patients must take the protocols that we've been always following, that is ensuring we wear face masks as well as ensure we maintain social distance. So to discuss more on this, to get us more details on what the recovered patients must do, joining us over the phone line now is Dr. Srivatsa. Many thanks, Dr. Srivatsa, for joining us. The Union Health Ministry has given out a set of protocols. Firstly, I'll come to the worrying bit of patients still feeling shortness of breath and a lot of fatigue even after being recovered.
True. Hi, Pratibha. Thank you for having me on board again. And it's always a pleasure to be discussing this with you. And like we're discussing, the Union Health Ministry has, released a guideline with regards to post-COVID management. The numbers, in fact, of 97,000 cases per day are quite worrying as the cases are climbing. But like you mentioned, the silver lining is that India has a large chunk of cases recovering at a fast rate. And that has definitely instilled a lot of confidence in the way we are managing this disease. And it comes at the right time. I feel that a protocol has been released on how to go about holistically, which is very important to attend to these patients and the post-sequelae.
Yes.
So COVID being a new disease, we are increasingly coming across a lot of signs, symptoms, syndromes, which are occurring as a fallout of COVID, and definitely rehabilitation will play a very key role in bringing out these patients from the after effects of COVID. And like you mentioned, some of the symptoms of fatigue, a lot of them I see in my day-to-day, recovery clinics seem to be complaining of sore throat, like you said, body ache, fatigue. And this invariably seems to be continuing for a period of almost 3 to 4 weeks, even after COVID recovery. And some of my patients are quite anxious that they still run low-grade temperature on and off, despite being discharged from the hospital. So now we must understand that COVID-19 is not only an infection that's been triggered by the virus, but it is also an inflammatory syndrome, and there are a lot of hypotheses with regards to this. that we have discussed earlier, the cytokine storm, the bradykinin storm, all of these put together seem to be having, collateral damages in the body. And this takes quite some time to heal.
Okay.
Right. So I always, put forth an example to my patients telling that you fall down, you hurt yourself, you have a wound, and the wound does not magically heal overnight. It takes its own due course. And definitely when the wound heals, there's a bit of scarring left. So invariably, some of these patients with COVID-19 pneumonia, severe type of pneumonia, seem to be landing up with some scarring in the lung. And this is being increasingly reported with regards to media as well as the medical literature. And we must focus on how to get the patients out early and help them in recovery so that there is no significant damage left in these patients.
Okay. In fact, these guidelines also say that in severe cases, these symptoms might continue for a longer time, which means that if somebody is asymptomatic, perhaps they are not going to see any symptoms even after they recover. But for those who had symptoms and severe symptoms at that, it's going to continue for a longer time. So is that what you have seen in your patients as well?
True. Definitely, the number of people who are landing up with severe symptoms are far few as compared to the bigger chunk.
Okay.
So 90-95% of them usually don't land up with much of symptoms and, might think it as a normal flu, just like they experienced it in the previous years. But the people who do get admitted to the hospital and those who land up in the medical ICU are the ones who usually experience long-lasting effects. And some of them might be a permanent damage and some of them might be recoverable. And we need to identify these patients well early in the course before the damage is done. And that is what is key over here. So we are working at set protocols within the hospital where I'm working to identify patients who will benefit from certain therapies to reduce the progression of, scarring in the lungs. And also some of these patients, they are stuck in the hospital on oxygen for quite a long time, for sometimes more than a month. And these patients do require to continue oxygen at home for some more time during their rehabilitation. Now, by means of rehabilitation, not only physiotherapy and other breathing exercises, it is important that the patients, get a holistic approach. And I think the present update has well spelled out what are the various aspects we can look at in incorporating the management of such patients.
Okay. In fact, these protocols have also asked for self-monitoring as well, which is extremely important for the patients as well to continuously monitor any kind of symptoms that they might be feeling, even if it is temperature. Apart from that, it also mentions group activities, including yoga or other exercises like walking as well. This and also, sharing their stories with others as well. Doctor, how important do you think that is for the patients to share their stories with the others? Because at least initially, it might not be so much right now, but initially there was a lot of taboo about COVID-19 as well. There were a lot of fears along with it as well. So for any patient, even if they have recovered, in fact, anybody even got tested, it was quite a worry for those around as well. So this can come in only with a lot of awareness to ensure that if somebody has tested positive or if somebody is going and getting tested, the others need not be scared about it, but they need to come out and help in any way they can, but of course ensure that they take all precautions.
Very true. I think it is it's of key importance to break these walls of stigma that have been built on patients, and it must be borne in mind that this is a completely curable problem. A lot of people will come out of it. A majority of it will come out of it, and they will develop antibodies and long-lasting immunity for the virus as well. Though the chances of reinfection is very small, but definitely there. But so hence, with regards to patients who recover and come out of it, it must be borne in mind that the safety precautions which they continued to follow before they were infected must be in place as well. For example, wearing masks, washing your hands, maintaining social distance, all these factors must be continued even after the discharge process. So that's a very important fact. With regards to the mental effects, like I'm working at ground zero, I realize that a lot of these patients have been disconnected from family They are being living in a, totally isolated environment without access to much of things. And that has a significant mental bearing on the recovery process as well. And that we must keep in mind as medical practitioners and the community. And definitely as a community, when this patient comes back to the community, it is our duty to, integrate them into the community by doing what is necessary. And such group activities will definitely boost the morale of that, the patient who's recovering from COVID-19. And it will also help to, instill in, self-confidence that he's recovered completely from the illness. And otherwise, it is likewise, we left scars in the lungs. We should not leave some mental scars in the patient as well.
Right.
And that is our collective responsibility.
Absolutely. Doctor, lastly, I want to ask you your advice, since you're dealing with patients on a daily basis, to those who have been discharged from the hospital or those who have recovered from COVID-19, apart from, of course, like you said, to ensure these protocols, to ensure that their immunity is boosted as well, what would you suggest?
So the most key important point is, like I already mentioned, to keep your safe distance again. One. Second thing is to be responsible to your family and family members. And third is to maintain a good nutrition by, taking highly nutritious food, try to avoid oily food, try to, avoid food from outside. A lot of proteins go about building the body again. We need to be on micronutrients like vitamins, minerals, all these things. Likewise, we are already using in the form of vitamin C, vitamin D, like you see, and zinc, to boost the immunity and the body's healing process, which is key. And we also need to, like the government says, rehabilitate, bring the people back to work. We already see that COVID-19 has caused a lot of absenteeism from work, and people fear getting back to work because the fear is that whether they will get reinfected. And the workplaces themselves are quite stubborn in certain factors, that getting back to work has become a bit of a hassle for certain people. I think these borders must be blurred so that work, goes on. And we, as a community, as a country, we don't suffer from absenteeism and the fallouts out of that. So I think it is key to, look at how to get back people to work. And physical exercise, getting back to routine work in a graded, stepwise manner rather than jumping into it all of a sudden. There are a lot of people I meet in my clinic day to day who feel, distressed that they're off work for a month or 2 months, and, getting back to work, is a bit of challenge for them. I hope that workplaces have a counselor or some person available to tackle these kind of, issues at work.
Okay. Dr. Srivatsa, many thanks for joining us with your expertise on that. So the Union Health Ministry has also given out its guidelines among the various ones that we have spoken about. Of course, also saying do everything you can to boost your immunity, ensure you are, walking and getting your daily dose of exercise. Yoga as well has been prescribed by the Union Health Ministry. Alternate medicine as well being suggested, but of course, doctors continue to advise to take all the vitamins and to ensure that you continue to follow the COVID protocol, including social distancing as well as wearing face masks. Thank you so much for watching this video. Please do leave in your comments as well on your thoughts on that. I'll see you in the next video. Take care.